We welcome you all to our first dental podcast, Intercept Early, Align Naturally. To discuss this, today with us we have Dr. Poojan Kamath, pediatric dentist, Identity Dental Care, Manipal. So Dr. Poojan, nowadays we hear the Invisalign aligners which are in trend. Most of the parents do ask us regarding the same, the usage of aligners in children. So can you elaborate on this?
Good morning. At the outset, I'd like to congratulate Dr. Praveen for his beautiful initiative of Dantagyan. In keeping with your question, orthodontics spans across preventive, interceptive, and corrective orthodontics. So, as a pediatric dentist, I'm trained to identify a problem early, intercept it in time to decrease the severity of corrective orthodontics. So, traditionally, appliance therapy braces were the norms. But with better digital workflow today, clear aligners is the way forward. And at our clinic, we work with Invisalign. Now, since we deal with a lot of growing children, Invisalign first is the approach that we follow for a more predictable and a positive outcome.
Thank you, Dr. Poojan, on explaining us about the usage of Invisalign first in children. Now, the next question what comes to our mind is about the palatal expansion using the Invisalign. So, how do you rate this expansion appliances to the conventional ones? So, do you find the palatal expander of Invisalign better than the conventional ones?
Yes, Dr. Praveen. So, since we are dealing with growing children and when we identify a tooth size arch length discrepancy, analyzing it and diagnosing it in time is very important so that we can not only align the existing set of teeth, but we also need to make room for the new incoming set of permanent teeth. And expansion works beautifully in such cases. So we've traditionally been using the rapid maxillary expanders or the slow maxillary expanders, which typically involves a metallic screw, which needs to be activated, which could sometimes be a little stressful. So as against the beauty of an Invisalign palatal expander is it is removable, but it has a snap fit, highly comfortable, they are customized, they are 3D printed, and it comes as series of palatal expanders, which you need to swap in the given format. So as long as the desired amount of expansion is attained, and since they are removable, dietary restrictions are not as much. Also, they can be easily removed and oral hygiene maintenance does not take a toll on you.
Yes, Dr. Poojan. One last question. Along with the Invisalign first and the palatal expanders that you use with the Invisalign, any other appliances related to Invisalign do you use, and what are your insights about that?
Yes. So another of my personal favorite is the Invisalign with mandibular advancement that is used in treating a class 2 malocclusion. Now, class 2 malocclusion needs to be identified early in time. It is typically an issue where there is a discrepancy in the growth of your maxilla and mandible in the antero-posterior plane. So basically, the lower jaw is deficient and you need catch-up growth. So the entire profile and the personality of the child takes a lift. Now, traditionally, we used twin block appliances or later in life fixed options like forces, but comfort and compliance is an issue. Now, with the introduction of Invisalign with mandibular advancement, things are much better. The comfort levels are much higher. The precision wings are customized in sync with your digital scan, which makes the results very much more predictable. We are having a great experience with this technology and appliance.
Along with the mandibular advancements, do you find any additional added benefits using an Invisalign twin blocks?
So another big advantage of the Invisalign with mandibular advancement is that since it's a tooth-supported appliance, the precision wings are designed in such a way that the overlap helps your lower jaw move forward in a very predictable format. But at the same time, it also moves your teeth, aligns them and levels them. So your duration of treatment is much shorter compared to the traditional route of treatment.
Thank you, Dr. Poojan, for your insights on palatal expander, Invisalign first and Invisalign twin block. I'm very sure that it would help our dental colleagues and also our audience to know about the Invisalign appliances. And also I thank you for being a part of our first podcast of Dantagyan series.
It's been my honest privilege to be invited as a resource person for your first podcast of Dentogyan, and I wish you the best of luck for the future ones to come. Thank you.
This was all about episode 1 dental podcast. Stay tuned on Dantagyan for more such videos. Please like and subscribe. Thank you.